So then you have this pain, you're saying, in the upper back?
Yeah, so it's in my upper back, but then also my neck. I have neck pain.
Okay.
But then I get a lot of lower back pain too.
Back
a lot of the
pain,
times,
too.
yeah. But it comes in waves. I think I put it on the paper, but like some days
Yeah.
will be worse than others. Yeah, and my shoulders do this like weird popping thing sometimes that I just like pop them out. I don't know if that's normal or not, but
You can dislocate them yourself?
yeah, I think so.
So like just put your arms out like this, and then I'm just gonna push on the bottom of your elbow.
Okay.
So yeah, you have like a little bit of hypermobility, and then we have it here too. Can you bring your pinky back down to your wrist like here? No. And can you bring your thumb down to there? You can.
Yeah.
And can you do it on that side as well? Yes. So the shoulders are kind of like a little bit what you have like in your elbow and your thumbs. Do your knees kind of go backwards as well?
Yeah, I think so. Like
Here, let me see. And one more time, all the way down to the window. So let me look at you from this side. No, it's not enough to classify. You just have hypermobility.
Okay.
It's not enough to say that you have a disorder, but you do have some. You have it in your elbows, and it's mostly probably in your upper extremities.
Okay. Yeah.
And it's genetic. Have a seat here and face that way. I want to feel your neck, okay? Never been adjusted, so what I'm going to do is feel the way that your bones move.
Okay.
Okay? This is usually a shock because people are always like, I didn't know I was sore there. See how this one glides nicely? Like, wee. Is that sore?
Yeah, that is sore.
Okay, if I go over on the other side, pushing, it's probably not as sore, right?
Right.
Not until I get down.
Not as bad as the other one.
Until I get here. See that? Up there. And that's what this adjustment's going to help you with, okay? All right, on your back, face up for me. Still sore probably right there. Is it as bad on this side?
A little bit, yeah.
A little bit?
Still feel it.
See this one here. You understand? I'm trying to get that to tuck under.
Yeah.
This just gotta go weep because it's used to it. Up here,
It's not.
so I go and I make it move.
Okay.
Force it down. I kind of like go give it an adjustment. Yeah, all in here. My first ever symptom of pain, like spinal pain, was at 24. It was right after graduating with a bachelor's degree. I was like, I'm in pain. I'll go become a chiropractor.
That's what I've been saying. Like, is this when everything starts to hurt?
Yeah. Fortunately.
But also, you make it look a lot easier on video than it actually is. Like,
Well, you're probably feeling this right now.
Yeah.
What I'm doing. It's not easy.
no.
Now, any dizziness when I'm doing any of these things?
No.
Not feeling nauseous or...
No, just trying to remember to breathe, though. Like,
Is it intense? I can always back off. You don't have to, like, suffer in silence here.
it's not intense. It's just, like, I've never felt...
Your neck before, yeah.
Yeah.
Well, so what I'm doing is I'm going through all these vertebrae. And I'm testing... I kind of use the oil, right? And I'm testing how they move. So it's... Sure, the muscles are there, but I'm really seeing what the integrity of the bones are. Like, can she do this? Ow, that hurts. You know,
That definitely
that
feels sore.
one. Yeah, that's stuck. Now, remember that feeling right here, okay? Because let's adjust it and you're going to see what happens. It's not going to hurt. It just makes a sound, okay? Chin back. Just like that.
Feels good. Much better.
All right. That's all that is. Other side. Hurt. Should feel like, oh.
It does feel good. Much
Yeah.
better.
Yeah, should feel like, oh, you got it. Like scratching an itch that you can't get. Good. Excellent. Great adjustment. We're going to have to work into this one. But very good. Right, here's this side. But now watch where this all moved.
Oh, I can feel it moving now.
Yeah, you feel it? Isn't it nice now?
So much better.
And it hasn't even drained yet, okay? It'll drain over the next 24 hours, and you'll go, whoa.
It's already. Yeah.
Yeah. All that inflammation has to come out of there. Takes a little bit. Now, what I did to the neck, I have to do the whole way down. I'm just going to push down. Any pain when I do that?
No.
Just tight?
Just so tight.
Yeah. And if I go like this?
No pain.
Nothing? Okay. Toes? Anything here? Any broken toes in the past?
No, but I have trouble like popping my toes. I don't know why.
Well, they're kind of hard.
Yeah.
You know, it's not easy. I mean, that would be about as hard as I would go. This is a little bit, that's stretched. Hold on. Does it hurt when I'm doing that?
No.
I don't want to pull harder than that. You see what I'm saying? Good. Ankles. Little stuck here. I am going to drag you down the table a little bit. Don't worry about fixing yourself. You'll be fine. Excellent. There it goes. Bend your knee for me. Oh yeah, so you do have some, you know, you are stable here in your hips and your knees. So it's not like your upper extremities. I can feel the integrity here.
Mm-hmm.
That's good. Okay. Because we were like, how are your knees and everything? No, they're fine. This is all
That's good.
excellent. Yeah. Hip. That was your hip socket?
Oh,
Other one. Good. Good. You're like, you didn't do that. It's all in the wrist. I want you to come on up and just see how the neck feels, okay? Make sure you're okay. If you need water, we'll get it.
Feels much better. I feel like light right now.
Good. Good. Okay. Next time you come in, you'll be an old pro and you'll know where everything goes. So you're going to feel me pushing, okay?
Okay.
Pushing down the vertebrae. Let me know if anything's overly sore. I can tell that this probably is sore. I was looking at your posture. I was like, well, she's got a curve here. Here's the twist on the left. And then this is where it's locked.
I feel.
This is where you don't have any movement. And that's common
Okay.
because there's a diaphragm here and it tends to get overworked and the body just really spasms here. Yeah, right in here. All right, you ready for these?
Yeah.
Okay. Take a deep breath in. All the way out. Here we go. Okay. All right. I'm going to go right up at the top. You've got 3 out of place here. 1, 2, and 3. Okay.
Okay.
I'm going to see if I can get them all in one shot. But I probably will have to do it in 2 pieces. Okay.
Okay.
Take a deep breath in.
Whoa.
Almost. Almost got them all. We got one more here. Perfect. Good. Excellent. Okay. Breathe. I'm going to pull the skin like that.
Okay.
Sorry.
It's okay.
Almost done. Done.
It's crazy as my grandma used to do that to me when I was like a kid and I hated it, but
You're like, wait a second.
yeah. Like she was onto something.
I'm going to put pressure here, all right? Anything hurt when I do that? No? How about here?
A little bit.
But not bad. How
No.
about here?
Nothing really.
Okay, I want you to take this leg straight up as high as you can. And down. And then same thing other side. A little bit more restricted there. Good. So I'm going to first kind of work on this stuck region here. And then you'll feel me go into here. Doing okay?
Mm-hmm.
Deep breath in. Breathe. Keep breathing. Yeah, breathe. I'm going to use my elbow. Deep breath in. I'm going to put pressure. And hold. Hold it right there. There's my shoulder popping. Sorry.
It's okay.
There we go. Yeah. Give it a little break. Other side. Breathe out. There it goes. Okay, we're going to do the pelvis. This part tends to be tender, so let me know if it's too much again, okay? She's saying she has pain down in here, so.
That feels a little tight.
I'm sorry. There we go. Perfect. Other side. We'll have to ease into this one little by little, okay? You're pretty sore there.
My shoulders definitely feel sore.
Oh, I'll go later. Okay. Breathe. It's all that studying. This one's sore too, huh?
Yeah, it is.
Okay, oh my. Feel all that?
Yeah.
Yeah, the adjustment's a piece of cake. Okay, do they feel kind of like uneasy there?
A
Go ahead
little
and
bit.
arms behind your back. Open up the front. There you go. Breathe, just keep breathing. Breathe, deep breath. Get this one over with. There it goes. Perfect. Arms up and above your head for me. Take them this way. There you go. Doing all right?
Mm-hmm.
Then I'm going to go right here. There's a nerve here.
Mm-hmm.
And done. Arms down. I'm going to go back at this one, okay?
Okay.
I want you to breathe. I'm going to count backwards from 5.
Mm-hmm.
See how I do. 5, 4, 3, 2, 1. Okay. Now I'm going to tuck your chin for me.
Like this way?
Yep. And then relax into the table. There we go. Good, 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 good. Okay, relax, relax. Take a break. Take a break. Keep scraping, okay? If it starts to feel hot, like uncomfortably hot, tell me.
Okay.
But otherwise, it just should just feel like warmth.
Yeah, I've seen that some people get really red.
You're already bruising just from me pushing on the sports bra.
Oh, wow.
It like you have like little crisscross marks from the just pressing. So that usually means you might bruise. Okay. That's the scraping, okay?
Mm-hmm.
It's a gradual rise in heat. You got 2 ribs right here that are inflamed. Doing okay?
Mm-hmm.
Right in here. Is that okay? I'm gonna pick this one through, okay?
Okay.
Might get a little hot. Are you okay?
It's getting more intense, but not that bad. I can handle it.
Okay. That was all I needed to do.
Oh,
But
okay.
you do have a little bruise there. Take down into here, the scraping.
Okay.
You can see it. I'm gonna pull this one out. Tell me to stop at any time, because here we go. It's getting too much.
Okay.
There. Okay. Doing all right?
Yeah.
Do you want to, like, are you hanging in there in the front?
It feels good, yeah.
Okay, I'm just making sure you're all right. Scar there.
There's something over there.
Yep, we'll get rid of it. That's what this does. There you go. But you're hanging in there.
Mhm.
Doing good. You just feel like a lot of warmth going in there.
Yeah.
I feel like you're more sore over here in some ways. Huh?
I kind of feel that, yeah.
Like, yeah, we're like sore down at the end here.
Especially right there.
Yeah, I feel,
Shoulders.
do you feel like all the crunchy?
Yes.
Like, whoa.
I just wasn't sure if that was like normal or not, but I usually do feel
Here we go again.
how
It's the
crunchy it
same
is.
thing that you have over here on the neck, which I'm
Uh-huh.
going to get to in a little bit with the scraper. It's just a callus from the forward, from the rounding of the shoulders.
Okay.
The body's
yeah.
like, well, God, you're going to pull on me, then I better reinforce it.
Yeah.
Should we fill in all the gaps? There we go. All right, so now tuck your chin, and we're going to do the neck. There it goes. There you go. Sorry. First time is always the roughest, okay?
Okay.
Not too, you have a little bit over here?
A little bit, yeah.
It's not too bad. The fascia continues all the way up into the scalp, so I'm checking it. You know, it doesn't just end here.
Oh, yeah.
It goes all the way up. Just gonna pull a little bit here, okay?
Okay.
Take some pieces. Do you get headaches here?
Yeah, I've been getting a lot of headaches lately too. Which I didn't know what.
Yeah, I'm
The
like, wait a
cause was.
second. Because this right here, look. Yeah, okay. So just have your head to the side, kind of like that. I'm just going to open up this suture here. Wow. Okay. And then down. Good. 2. So there's neck. So here is the upper back.
Oh wow. That doesn't even like it looks like it would hurt.
But like, go ahead and feel it.
Oh, it feels warm.
But it's not sore. I didn't break the skin.
Mm-hmm.
And then here's your neck.
So then where it's red, it'd be like the most.
That's the low back.
Okay.
Okay, and that's what you have there.
Oh wow.
It's not bad though. All right, hands on your hips for me. We're gonna do the shoulders now, okay? So as straight as you can. And then elbow back and towards mine here. Just push as hard as you can towards the back wall. There you go. I'm just gonna check your everything, okay?
Okay.
Good. And this elbow here, I'm gonna check this shoulder.
Same thing.
Same thing, you're gonna push back towards the wall. And then we're gonna look chest out, look up, relax this. Good. Now elbow back. That's as much as it goes. Oh. No, it went. Just didn't clunk.
Oh.
There you go. Okay, lean away. Lean your whole body away from me, like you'll feel it separate. Yep. And that's what you do, okay? Good. Just seeing if there's any kind of, what happens is inflammation will sometimes make the ear stick to the skull. But I don't feel nothing is too bad, okay? Really, I think it's just posture correction. That's where we are. And a little bit of a cleaning. Then done. Okay. Take a deep breath. We're going to adjust right here, okay? Let this one go. Perfect. Other side. There we go.
Okay.
You don't realize how far back you can go. It's like, oh no, all the way back. Take a deep breath in. There they go. On your back. Very nice. Take a break. All right, this one's optional. Totally up to you. The pelvis has a third joint, which is in the front. However, it's in between the legs. Sometimes they need it. Sometimes they don't. There's no way for me to know until I do it.
Okay.
It's up to you, though.
I'm okay with it.
Okay.
Yeah.
Okay. You can hold on to them or whatever. Okay, so my hands are going to be on your knees the whole time, okay? You're going to first press out against my arms. You're going to feel it in your hip sockets. So press out as much as you can. Good. And relax. Now you'll feel it in between the legs.
Okay.
So squeeze. More.
Oh.
There you go.
That felt so weird, but
And it feels so odd. It feels like it's like, is my leg gonna come off?
yeah,
You
it
know?
did feel really weird.
It's this one here, okay? And then there's these here. These two I adjusted down here. What I just adjusted now is this one here. So yeah, this is one that nobody knows that they have. It's like, yeah, you got one over there. And when this one gets tight and locked, these two get irritated. That's a head to toe, like every joint moved, okay? Now I'm gonna teach you how to do the posture part, okay? Okay, is it centered in your back?
Yeah, I think so. I'm also feeling so.
Very good though. First adjustment, huh? You're
Great.
you're doing okay,
Oh, yeah.
huh? All right. Straight out in front of you. Yeah.
Oh.
No, not like that. Oh. Come on back, and then roll to the side. That's what you want.
This is much better.
Yeah. So in order to get straight posture, it's not comfortable. You know what I mean? Everybody wants to do this.
It's more comfortable, but
Because it's
easier.
comfortable.
Sure.
Because the eyes are on the front. Beginning, you're like, wait.
Why should I put myself through pain?
Yes,
to feel better.
feel better. Right. But you have to learn to stretch. It's almost like coming out of a split.
Yeah.
Have you ever practiced in cheerleading, right? You stretch, and when you come out of it, you're like, oh,
Yeah.
It's like that, but it's here. So it's a strange feeling in the beginning. Okay. Any other questions, though, for me at this moment?
Not that I can think of.
Okay.
I'm
If
so
you
thankful for you.